Thank you for your interest in our fellowship. My name is Roman Atoli, and I'm the program director. And in the next few minutes, I'm going to provide you with information about our fellowship. If you have further questions after viewing this presentation, please don't hesitate to reach out. We are an ACGME and Orthopedic Trauma Association approved fellowship. I would also like to acknowledge our grant support from CODA, Omega, and the AO Trauma Long-Term Fellowship. We abide by the Code of Conduct when it comes to interview season. Please familiarize yourself with the Code of Conduct from both the applicant and fellowship program perspective. Indiana University School of Medicine is working to diversify the workforce and graduate more physicians from underrepresented groups and ensuring that all trainees are prepared to provide culturally competent care for patients from all walks of life. The Underrepresented in Medicine Visiting Residency, which is sponsored by Faculty Affairs, Professional Development, and Diversity, supports residents who want to pursue a fellowship and provides them with the opportunity to spend time at our facilities. For more information, please see this website. Finally, though interviews will be virtual again this year, Indiana University School of Medicine is trying to organize 2 days for potential applicants to come and get to know our facilities as well as the city of Indianapolis. With those housekeeping items aside, I'd like now to turn to the question, what are the ingredients to a great fellowship? Through the rest of this presentation, I'll hopefully show you patients and cases, faculty to teach and mentor, and a structure that allows those to take place are the key elements to a great fellowship, which we can provide at Indiana University Orthopaedic Trauma Fellowship, Methodist Hospital. The IU Methodist Orthopaedic Trauma Fellowship is ACGME accredited and offers 2 spots yearly. It is associated with Indiana University Health, which is the largest hospital system in the state, and is partnered with the Indiana University School of Medicine, which is the largest medical school in the country. It has several lifeline bases located across the state for rapid transport of critically ill and injured patients. The IU Health Medical System routinely garners awards and recognition. The health system's motto is the best care designed for you. I feel this spirit spills over to our fellowship, where our goal is the best experience designed for orthotrauma fellows in training. How we accomplish that will be explored through the remainder of this presentation. One of the key ingredients to orthotrauma fellowship training is an adequate volume of patients. The state of Indiana has 3 level 1 trauma hospitals. Methodist Hospital, which is where the predominant amount of training takes place, is the largest of these 3 level 1 hospitals and provides substantial experience with both acute and post-traumatic orthopedic conditions. The hospital seen pictured here is an 802-bed level 1 trauma hospital with over 3,600 trauma admissions a year, of which anywhere from 550 to 600 have an ISS greater than 17. We perform over 3,500 orthopedic procedures a year and have a dedicated orthopedic core with 6 operating rooms, of which at least 3 orthotrauma rooms are running daily. A typical day has 3 ORs for orthopedic trauma, but there are only 2 fellows. The fellows are responsible for choosing and preparing for the cases in which they will participate. Yearly, the fellows log over 600 cases and well over 900 CPT codes. Our cases span the breadth and depth of orthopedic trauma and post-traumatic reconstruction procedures. Shown on the left is the average number of cases done over the past several years according to type of fracture. Another key ingredient to the trauma fellowship is the faculty that you will train with. We have 8 faculty devoted to the Orthopedic Trauma Fellowship, who are all fellowship trained in orthopedic traumatology from 4 different institutions across the country. Collectively, there's near 100 years cumulative experience in orthopedic trauma. Dr. Walt Verkus is the director of our orthopedic trauma service. He is dual fellowship trained in trauma as well as oncology. In addition to orthopedic trauma, he has a robust hip arthroplasty experience consisting of both primary and conversion total hip arthroplasties done direct anterior, anterior lateral, as well as posterior. Dr. Tony Sorkin is the founding program director for the Orthopedic Trauma Fellowship and continues to serve in an advisory role. He is additionally the executive director for population health for Indiana University Health System. His license plate reads, "I am Naylor," and his virtual name for Zoom and WebEx meetings is Tone Bones. In addition to orthopedic trauma, he has an extensive experience in post-traumatic foot and ankle reconstructive procedures. Dr. Todd McKinley is the director of our orthopedic trauma research program and has brought in more than $10 million in extramural funding. His teaching and mentorship has shaped our approach to complex pelvis and acetabular surgery, and he additionally does about 50 periacetabular osteotomies per year. Dr. Brian Mullis is the program director for the Indiana University Orthopedic Residency and is also very involved in both the AO and OTA organizations. He also serves as an ABOS board examiner. Dr. Jan Schakowsky is dual fellowship trained in both trauma as well as foot and ankle. He has special interest in post-traumatic arthritis of the foot and ankle, as well as complex foot and ankle reconstruction. Additionally, he has a passion for orthopedic education, and you might know him from the Ortho Bullets website. This is me, and in addition to my trauma practice, one of my main roles is combating the inevitable entropy associated with running an orthopedic trauma fellowship program. Dr. Johan Jang has recently returned to us from Missouri. He did his trauma fellowship here at Indiana University, where he also did an away rotation when he was a PGY4 resident. Coming back to Methodist for the 3rd time, I would say one of his special interests is this hospital. Our final faculty member is Dr. Luke Lopez, and he will be joining us from the Florida Orthopaedic Institute in Tampa. As of 2020, the faculty had a cumulative experience of 90.5 years. Within the next 2 years, this will surpass 100. Simply put, our fellowship has 3 main objectives. First is to graduate clinically excellent orthopedic traumatologists. The next is to develop effective educators. And finally, to engage our fellows in the research process. I think we have a very thoughtful as well as intentional approach to accomplishing these goals. Typical day starts at 6:30 in the morning with our fracture conference. This is attended by faculty, advanced practice providers, the 2 fellows, as well as residents and medical students on service. We go over new consults from the previous day, discuss preoperative plans in depth, as well as review the prior day's x-rays. And occurring each day really represents the foundation of the fellowship education mission. Following that meeting, the workday begins. Fellows go to clinic 1 day a week and otherwise spend 4 days in the operating room. We have a robust conference and didactic education schedule. Weekly Tuesday, Wednesday, and Friday mornings each have an hour devoted to specific educational conferences. Each month we also have journal club, multidisciplinary meeting with our general surgery trauma colleagues, research meeting, indications conference, as well as a department-wide morbidity and mortality conference. The schedule offers fellows multiple opportunities to advance their educational capabilities. Journal Club is routinely hosted at one of the faculty's houses, allowing us time to get together and socialize outside of the hospital environment. Also part of the curriculum is 4 to 6 Cadaver Labs yearly. These are fresh frozen cadavers and are fellow-specific level education, although occasionally residents and medical students will join for observation. The labs are led by faculty, 2 to 3 faculty at a time, and they come complete with C-arm, as well as instrumentation for practice with dissections, application of plates, screws, and nails, and doing procedures that are percutaneous, guided by fluoroscopy. The Indiana University Orthopaedic Trauma Division also takes research very seriously. Our research efforts are led by Dr. McKinley, who has secured over $10 million in grant funding and is the nationwide primary investigator for a multi-center prospective observational study funded through Metric. We also participate in a large majority of Metric studies and are an anchor site for that consortium. Please see our website for publications over the last several years. As a fellow, we do expect that you will participate in a research project that goes from design of the project all the way through manuscript preparation. To facilitate that, on average, there's dedicated research time 1 afternoon per week. There's a year-long research curriculum so that we can all keep tabs on projects that are going on, discuss hurdles as they come up, and strategies for getting around them. And we also have 5 full-time research coordinators or assistants that are dedicated solely to the orthopedic trauma service. We're really here to help facilitate all aspects of our research program, including related to the fellows projects such as IRB submission, data acquisition, and some other logistics that come up from time to time. While we have historically been able to offer a 2-week international opportunity, focusing most recently on Eldoret, Kenya, the COVID-19 pandemic is preventing that from occurring this year, and it is unknown what the status of the international opportunities will be in the years going forward. It is our goal, however, to re-engage in those opportunities when they become available. Fellows attend the OTA annual meeting and additionally attend a pelvic and acetabular cadaveric dissection course and also either the AO or OTA Fellows Trauma course. Time off for these courses is allotted and not taken against PTO. Other additional perks of the fellowship include lead, full health benefits, provided with dry erase pelvises for mapping out acetabular and pelvic ring injuries, a food stipend, and also an X-Fix guard dog. In order to minimize, and I would say nearly eliminate, service-related responsibilities, as well as mitigate compressed work schedules, and finally optimize the fellows' experience, we have ample clinical and administrative support for the fellowship. This includes our awesome fellowship coordinator, Holland Mangione, a team of advanced practice providers, of which 3 to 4 are available during the day and 1 on most nights, with the primary responsibility of doing the inpatient rounding as well as responding initially to consults in the hospital. We also have a PGY3 from Indiana University residency program assigned to the service, and a PGY2 foot and ankle resident that rotates with us several days a week. I think if asked, both the residents and the fellows find the interaction between themselves to be favorable. There's really no concern of things such as double scrubbing, as there's plenty of work to go around. Some final details. At-home call is 1 in 3 weekends, plus the occasional weekday. And on average, the fellows on call 8 times per month. And we have a thoughtful and intentional progression over the year to increase fellow autonomy. Further, fellows are integral members of our program evaluation committee, which meets quarterly to discuss possibilities for program improvement. Finally, as the program director, I meet quarterly with each fellow to give formal feedback following the clinical competency committee meeting, where we go over the results of the committee and work together to develop a learning plan for the next quarter so that we can see continued improvement throughout the course of the year. One of the chief ways that we maintain growth throughout the course of the year is through mentoring, and having 8 faculty and 2 fellows with a very favorable fellow to faculty ratio. Our model, as seen here, is to provide a high degree of support, but at the same time a high degree of challenge, so that we can watch the fellows grow over the course of their year in training. Shown here is a microcosm of Methodist orthopedic trauma, of which about 90% is blunt, even though we do have the occasional penetrating injuries. We then take those images and turn them into these beautiful looking x-rays and teach our fellows how to do it as we go along. But there's more. There are also substantial possibilities in terms of hip arthroplasty and conversion hip arthroplasty, periacetabular osteotomies, multi-ligament knees, and a development for an appreciation of the soft tissue reconstruction required to take care of our orthopedic trauma patients. However, we will not be doing microvascular free flap anastomosis. And all this training takes place in Indianapolis, a city with a small town feel, but also all the necessary things associated with big city living. And I can say that. I've lived in Chicago, Houston, and Baltimore. And my wife and I are very happy to have settled in Indianapolis and are proud to call ourselves Hoosiers now. In the upper left-hand corner, we have the downtown skyline. In the upper right, you have the Indianapolis Motor Speedway, where the Indy 500 takes place every year. And in the lower right, Lucas Oil Stadium, which is home of the Indianapolis Colts. The city is host to multiple top-ranked universities, with Indiana University nearby in Bloomington, Purdue University nearby in Lafayette, and Butler University right here downtown. Also professional sports teams, the Colts, as I mentioned, the Pacers, also minor league baseball, minor league hockey, and an excellent zoo and world-renowned children's museum. Each year, Indianapolis also hosts the Big Ten football championship game, as well as the NFL Combine. So what makes our fellowship unique? First is the exceptional clinical experience, which is anchored by 8 fellowship-trained attending staff and a substantial case volume of both acute trauma as well as post-traumatic issues. Next is our exceptional research experience. We're a very large contributor to the metric. Fellows participate in a project from the beginning stages of design and grant writing all the way to manuscript preparation. And finally, the ability to see a spectrum of research ranging from basic science to multi-center randomized controlled trials. And finally, an exceptional educational experience, which includes our dedicated orthopedic trauma cadaver labs, multiple points where the fellows can exercise their educational capabilities through morbidity and mortality conferences and didactic education sessions, and finally the ability to teach learners and trainees at multiple levels ranging from medical students all the way up through junior level residents. If you have any further questions, please don't hesitate to reach out to myself or our program coordinator, Holland Mangione. Look forward to seeing you either at our virtual info sessions or later on this year for virtual interviews for our fellowship program. Thanks for listening.